We wanted to just take a few moments to update people on, what's happening, what's new in MHCDS. We always come back to the core. What are we doing with all of you when we bring you together? We're trying to help you all, and with us, we all do this together. Envision the future. Think about what will it take to lead change. Once you have that idea of where is it we're going, what should it look like, and we're helping all of you, and really together we're helping everyone to develop professionally. And so, with that in mind, I just wanted to talk about a few sort of ways that the curriculum is evolving, and in particular, we have a lot of new faces, and we're very excited about the way we've reimagined some portions of the curriculum and the courses. And I do want to remind you that as alums, for the many alums in the room, you are welcome to audit online courses. So just contact Beth Perkins for that if you're interested in that. And you're also welcome to participate in virtual seminars that we've had over the, we've had a whole variety of topics, everything from, making policy to the nuts and bolts of MACRA to, all kinds of different topics in our sort of virtual grand round. So, you can take an hour out of your day and learn something new, get a little, booster from MHCDS. One of the places we're updating, when you all arrived on campus many summers ago, in some cases, we started with this notion of this course of the science of healthcare delivery, and we're really kind of revisiting how we do that, how we bring students together and define what we think it means, and also try to introduce you to what I'm going to call here the Dartmouth School. But it's really this notion of Dartmouth is known or made a name for itself having this kind of healthy skepticism, asking these kind of uncomfortable questions about our healthcare system, like, why are we getting so little when we pay so much? And so we're going to have John Skinner and a variety of guests will be helping us with that this summer. We're going to bring Bill Nelson more into the residential. Many of you have had Bill talking about ethics in healthcare, and this is less about the ethics of should I take this particular drug, but how we think about ethics in the context of healthcare organizations. So he's going to be a bigger footprint in that residential session. And of course, we'll have the curricular themes of change management with Paul Argenti, innovation with VG, and as well as, topics in health economics, and also thinking about something that gets left out sometimes, although you all certainly are not leaving that out this morning, but sometimes people forget that as organizations, you're also employers, and Mike, launches us thinking about employers and what they can do around healthcare. And then we're going to lead, something that you all have done and we will continue to do is you've learned about some issues around numeracy. If you're going to talk to people, if you're going to think about people, if you're going to try and make data-driven decisions, you need to have some level setting around numeracy. Not, for those of you who went to medical school, that's not always been top of what was covered. And we have a new faculty member at Dartmouth, Lindsay Leininger, who's going to introduce that in this year's residential, and that also leads into her course. She has completely reimagined the leveraging data course to really think about, what is the toolkit you need to do sort of data-driven management decisions. And she's really split it up into, there's ways in which you need to describe data. That's a super important part of what you're doing. There's ways to use your data for prediction. When you all are trying to identify who is likely to go off the rails as a patient, where do I need to intervene? I'm using that for prediction a lot. We're evaluating. We make these changes. It's super important that we evaluate them rigorously and in ways that can distinguish, what the intervention may have done versus what other external factors that we're all going through might have done. And then thinking about, this thing that is so hard to wrestle in our healthcare system, so issues around measurement and how do we measure when we've succeeded. So we're super excited about that. She already taught this in last fall, and it went really wonderfully, so we're happy to have you all meet Lindsay. And then we also have Carrie Kalla, who I'm happy is here, is going to join our team in health economics and policy. John Skinner is stepping away from that course, but Bob Hansen and I and Carrie will be teaching it. So Carrie Kalla is an associate professor at TDI. She's a health economist, and she has a lot of expertise in alternative payment models. And in fact, since 2012, she's been spearheading, along with some colleagues, but really spearheading the national surveys of ACOs that Dartmouth has really become known for. We've just completed the 4th wave of that. I was privileged to join it to learn some things about behavioral health, and so it was super inspiring to hear this morning about some of these really innovative ACOs. She's also an expert around low-value care and policies to reduce it. And she's been getting a lot of exciting expertise around health policy. She spent the 2017-18 year as a Robert Wood Johnson Health Policy Fellow and was able to work in Nancy Pelosi's office during that time. So she brings a lot of great strengths to that course in health economics and policy. So we're super excited to be rethinking how we do that. And then also in population health, we have Amber Barnato, who's also joined us at TDI in the last couple of years. She is a clinician. She has her background in public health and preventive medicine. She also thinks about issues at the other end of care, lots of end of life and critical care issues. And in fact, she just finished her palliative care fellowship here at Dartmouth. But her research spends a lot of time thinking about patients in these different situations, both end of life and earlier. And she spends a lot of time designing quite novel interventions for providers. How do you nudge providers in the right direction? And so we are very enthusiastic about Amber joining us to lead the Pop Health course. So I'm going to turn it over to
Again, really great to see everyone here. One theme of this symposium has been the need for innovation beyond the typical methods for healthcare delivery. And along that theme, we're introducing a new course into the program. Actually, it's had its first brief run with the class of 20. It's called Human-Centered Innovation. It's taught by Professor Alva Taylor from the Tuck School. It builds on the very vibrant study of design thinking that's been sort of pervasive in industry these days. And it was overwhelmingly successful the first time around. I actually have a quote, I suspect written by someone in this room actually. This person wrote, "Every aspect of this class was mind-expanding, mind-opening, and instantly helpful." So I can't think of a better recommendation for a course. And everyone else wrote that the course was way too short. So that's something we can solve pretty easily, and it will be a larger course in the upcoming class. Sorry, for the 20s. This was for the 19s, and this is sort of Alva's take on the class. Innovation deeply considers experiences, and he really gets the participants to think about what patients need and then to design from there. It's a wonderful class. So within every existing course, we really are trying to innovate more or less continuously. Just 2 examples. There are 2 major efforts to improve the cases that are being used in the classes. Paul Argenti and Mark Vrajas, for example, from the class of 17, are working on Cedar-Sinai case, sort of a one culture case that would replace the existing one culture case that they're using. Pino Audia and a current student, Joe Underwood, are actually working on some videos on leadership styles. It's really fun to be creating new things with existing students. It's kind of a unique thing about this program that you don't see in a lot of other programs. One thing that we got, especially from the most recent classes, actually from all classes, as we solicited feedback, was the need to really increase an understanding of diversity and a more inclusive environment and a more inclusive curriculum. So it's something we've been working on as a program quite a bit. Katie ran a variety of focus groups of students to try to understand where we're falling short and where the opportunities were. And this led to quite a few great ideas, I think. One idea, of course, is to work with our staff and our faculty on the way that we talk about diversity and the way we involve students. And we've revised our training standards and our recruiting to some extent as well. The effort has extended to George, of course, who always tries to recruit a very diverse class with a lot of points of view. Staff recruitment has changed as well. This symposium itself is more or less an outgrowth of that effort. One last idea that we're working on right now is we're calling MHCDS stories, and this is brand new. We're just, our fingers are crossed. It's a student-led, we hope a student-led effort, where students are going to help each other to curate, design, and then deliver personal narratives. If you've heard the Moth Radio Hour, for example, it would be sort of modeled after that. We envision the students presenting these stories, and we're actually hoping that the faculty and staff get involved as well. The idea here is to understand what drives us, what motivates us, what gives us meaning, and to sort of recognize that there's often hidden diversity in a class. Someone you look at, you may not understand that they bring with them something really new and unique, and we're hoping that these efforts help to reveal that as well. So overall, this continues to be a collaborative effort. We really welcome your suggestions and your ideas.